Well, today I had the privilege of hosting the Grand Rounds discussion and kind of our post-conversation. I'm honored to have Dr. Matt McClean with us. He's a chiropractor at McClean Chiropractics in Provo, Utah. Today, our discussion was geared around surgical decision-making and primarily just really having a conversation about what our world looks like as advanced practitioners. So my role was basically just having the conversation about what happens in our clinic when we see a patient who's a potential surgical candidate. Tell me kind of what were some of the pearls that you gained from that?
It's just helpful to really see your decision-making and, what goes into what type of surgeries you would do, and which comes, which you do when, and what circumstances are.
And one of the principles that I've kind of led with was this good, better, best mentality. And I think it's a financial maybe saying, it deals in the financial space. But for me, the application is such that I try to tell patients right from the jump, there's generally and rarely a perfect surgical treatment options. But there's good, better, and best. And so we're trying to find the best treatment option, whether that be surgery or not surgery. We need to keep an open mind because there are various ways in which you can approach spinal pathology. Kind of the things I honed in on were the dilemma of, patients come in and I think they ultimately think I should be a candidate for a disc replacement. And I expressed some challenges and barriers that were faced with that. And as you just alluded to, maybe somewhat insightful of just the things that we're thinking about. Anything you'd elaborate there, though?
Well, it's interesting, cause we'll see the same thing in chiropractic. Well, some people will come in and they'll say, hey, you helped my friend with this, and they didn't need surgery. And we'll say, based on your circumstances, you might need surgery. So same with you. So based on, what we see on the imaging, what type of exam findings we see, it tells us, they might need a surgery, and this is the type of surgery they need. And so it's really helpful to be able to give them that information. So when we send them to you, it's not just a black box to say you go to have surgery, because that could be a disc replacement, could be a fusion, and that means there's a lot of difference in what type of surgery there is.
Yeah, and I think the ultimate goal of doing this subject for the discussions today was really just to generate this conversation of having an open mind when you come in for a surgical consult, understanding that there really is not a perfect surgical answer oftentimes. And so we're going to do our best to sift through the information. And I think it's important for patients to realize that we want to give you time to be able to tell your story, because I didn't mention this in the discussion, but I really feel like while physical examination is super important, but the patient's subjective symptoms and description of their pain and how it influences their lives, in addition to the radiographic findings, is, in my opinion, some of the most key information for me to obtain in order to make an accurate, or again, the best treatment option possible. So hopefully it was insightful. I really do appreciate you being present this morning and providing input from your perspective. We'll catch you guys next time.